Hi there, I'm Dr. Angie, and in this video, I'm going to be talking about kitties that are losing weight and we don't know why. This actually happens really commonly. This question comes from Pam, and Pam says, I have a 19-year-old male cat who's extremely thin, only has 4 teeth, and tries to eat nonstop. This is extremely common. He is always on the counters or in your face when he knows you're eating. We have been to the vet several times and have been told that all the labs are normal. He's not hyperthyroid and we should make his life comfortable. He's down to about 5 pounds and his stool is formed, but light tan in color. Is there anything we can do for him? Pam, yes, there is something you can do for him. So when your kitty's losing weight and you can't find a reason, especially older kitties, a lot of times it's intestinal disease. Cats commonly suffer from inflammatory bowel disease, and what can happen is as they progress through their life, it becomes worse, and then at the end of life, they just can't absorb anything. One thing that you can do is talk to your vet about trying a steroid like prednisolone, prednisone, or budesonide. A lot of time that takes down the inflammation, and it helps them gain weight and absorb their food. Now, steroids aren't my favorite, but for these cases, they can absolutely be life-changing. It's really uncomfortable to be hungry all the time, to be eating and then not absorbing anything, because your kitty's body's always telling them, I'm hungry, I'm hungry, I'm hungry. And it's a really uncomfortable place for them to be. Alternatively, and ideally, getting an abdominal ultrasound and maybe an endoscopy to biopsy the intestines could be the most helpful. If that's not an option at the age of 19, trialing steroids can be really helpful. So I encourage you to talk to your vet about either doing some steroids or an abdominal ultrasound. We also have a blood panel that can be helpful to let us know how well your kitty is absorbing B vitamins. So doing what we call a GI panel, and it's run at Texas A&M, can be really helpful to know or to point us towards the inflammatory bowel disease. So there is something you can do, and I want you to let me know how it goes. If you have questions for me, I'd love to answer them. You can reach me at Angie, A-N-G-I-E, at BoulderHolisticVet.com, and I will see you soon.